Everyone wants to get into Stanford's new grad RN residency. But what is it actually like once you start? Is it overwhelming? Do you feel supported? How long does it take to stop feeling like a baby nurse? In this video, I'm breaking down what it's really like to start as a new grad nurse at Stanford. Hi, I'm Cece, and welcome back to the Nurse Cece, where I help nursing students and new grads go from overwhelmed to confident and hired. If Stanford is one of your dream programs, then this episode is for you because getting in is only part of the story. You also need to know what the real first year experience feels like. One of the most honest takeaways from Stanford's panel was this: you do not instantly feel confident when you start. One new grad shared that around 4 months on your own, they were finally starting to connect the dots, more in their assessments. But even then, some days still felt like starting over. And honestly, that is one of the most normal things about being a new grad nurse. Confidence does not show up all at once, it builds slowly, shift by shift, patient by patient, and lesson by lesson. Stanford nurses described one of the steepest parts of the transition like this. When you're off orientation, you have to find ways to seek questions out on your own and ask when needed. That is such a real new grad experience because during orientation, you always have someone close by. Then later, when you're on your own, even though support is still there, you start realizing a few things. I have to think for myself more. I have to speak up more. I have to recognize when I need help. That shift can feel really scary, but it's also part of how you grow. One of the strongest themes from the webinar was support. New grads described having access to charge nurses, resource nurses, educators, fellow nurse residents, and experienced staff who are willing to help. And because Stanford is a teaching hospital, learning is built into the culture. That matters so much as a new grad. You are not expected to know everything, but you are expected to ask questions, keep learning, and use the support around you. One of the questions in the webinar asked about how overwhelmingly high acuity care can feel at Stanford. And one panelist explained that on their unit, they did not start off with the craziest assignment. Instead, they ease you into higher acuity patients, they give you education sessions, and they let you gain experience during orientation, while continuing to support you when assignments got harder. That is so important because strong programs do not just challenge you, they support you through the challenge. One panelist also talked about how intimidating provider communication felt in the beginning, and they described how during morning rounds, the providers would ask, "Do you have any concerns? Do you have any questions? What are your thoughts?" At first, that felt scary, but over time, they said they were no longer afraid to ask questions or speak about orders, which is a huge part of becoming a nurse. Not just learning tasks, but you have to learn how to speak up, think clinically, and communicate in interdisciplinary spaces. This part is what really stood out to me. A new grad said there are ebbs and flows. Some days you feel more confident. Some days you feel like you started all over again. That is such an important reminder because progress in nursing is not linear. You will have shifts where you think, "I'm finally getting this." And then a hard day hits and it'll humble you. But that does not mean you are failing. It means you are still becoming. According to the panel, some of the qualities that help new grads succeed at Stanford are openness to learn, willingness to accept feedback, adaptability, staying humble, and having a growth mindset. That means the strongest new grads are not the ones pretending they know everything. They are the ones who say, "I'm learning, I want feedback, I'm willing to grow, and I'm not above asking questions." That is a much stronger foundation than ego. Another panelist also pointed out how important it is to have things you enjoy outside of work. They mentioned hobbies and self care, something as simple as coloring, that help them to stay grounded in a demanding program, which really matters. Because if your whole identity becomes surviving work, burnout can hit really hard. You still need rest, joy, recovery, and something that reminds you that you're human, not just productive. If I had to summarize what it's really like to start at Stanford as a new grad, I'd say this: it is challenging, it's humbling and growth filled, but you are not expected to do it alone. That's the difference. It's not easy, but it is supported. In the next episode, I'm going to break down the salary, benefits, and whether Stanford's new grad RN residency is actually worth it. So if you're serious about applying, subscribe and keep following the series because we're building the full picture of what Stanford really looks like.